Good evening, everyone. Thank you for coming. I hope this session will be very useful for you because I understand people are writing the exam today, actually, and tomorrow and next week. I understand the exam interval window from 6th to 19th, I think. So we're not wasting your time. We are trying to be short and sweet, to the point, and uh, we will have some room if you have like questions or queries to answer them as much as we could at the end of the session. So let's start. Can you see my screen?
Yes.
Okay. So how we will work it tonight, we will go through three questions, and they are three for a reason. And after each question, I will ask a volunteer to do them. Don't worry at all. Don't feel stressed or you need to get it right. That's not the case at all. It's not like an exam. Just for the sake of the time and everyone time, we need someone to volunteer to take the question. Then you will propose your answer. We will discuss it. We will learn how would we answer as many questions as we could from a one question in the real exam. And I'll be talking through that. So who would like to take a question one, please? Any
I would
hands
like
up?
to.
Yes, Doctor. Who was that?
Yeah.
Laksha?
Yes, doctor.
Yeah. Would you like to take this question, please?
Yeah. Should I read it aloud?
Yeah, please.
Okay. You are an FY2 doctor working in a busy outpatient clinic. You are currently consulting with a patient who is visibly upset and teary. During the consultation, a nurse knocks on the door and says that the nurse in charge is very concerned about another patient and needs to speak to you urgently. Rank the following options.
Okay. What do you think? So the way that we work question out, we read the stem, then we tell ourselves what concepts are we talking about? What are the major concerns? What are the major concepts here? Then
Okay. Sorry.
we apply some skills. So the skills are different from the concepts. So what concepts are we talking about here, Doctor?
So we are talking about they are testing our empathy as well as pressure, how we manage in pressurized situation. As
Okay,
the
so you
nurse
are
is
under
also,
pressure. I agree.
yeah.
You have a patient who upset and teary. That's a very good hint. You have to pick the hint up. That's very good. And you have an concerned nurse. So if we are classifying that into concepts, we would say number one, this is the way that we work the SJT out. Number one, we have like a patient care or patient safety issue. How come I say that? Because you have a very senior colleague who is nurse in charge. She is concerned about someone. This is a hint for you. Even though if the concern has been raised by medical student, student nurse, whoever, that doesn't matter. But they are just making life easy for you by telling you this is a very senior staff. She is the nurse in charge. She is very concerned, not concerned, very concerned. So we are just talking about hints. Now you have nurse in charge. She is very concerned. This is a very strong hint for you to know there is an potential patient safety, potential immediate patient safety. This is a major concept in your head. Very good. Number two, you have a patient in front of you who is upset, who is teary. So there is like a patient dignity, patient feelings. This is very, very important. Okay. How would you go through the options? Tell us.
Okay, so first of all, now as she is very concerned, so I need to listen to her concerns. So I would like to talk to her through call. I'll tell the nurse that you can put me through the call so I can directly get in connect with the nurse in charge and talk to her, which is option B, I feel.
So tell us about what you feel about A, B, C, D, in
Okay. Yeah. So about A, the nurse who has come. So I feel that A means the nurse who has come to me to talk. I'll take the message from her. We'll also do the thing that, okay, I am taking message that, okay, I'll prioritize, is it emergency or what it is. And
okay.
then Option
So
C,
do you
tell
think
the
A
nurse.
is the upper tier option or lower tier?
It's a upper tier option, I
Very good.
feel. Yeah. Okay. Shall I move to C?
Yeah, yeah, please.
Yeah. So tell the nurse that you are currently busy. It's like neglecting the pressure or neglecting the seriousness of the condition, but it's a lower tier. I feel C is lower tier.
Okay.
Okay, let's move to option D. Ask the patient to excuse you briefly and step out. This will be not a good option as the patient is teary, so I wouldn't ask the patient to do that. So this will be the worst option. D, I'll put the last. And we are left with the tell the patient to leave so that you can attend the nurse in charge. Ask the sorry, I'm so sorry. Ask the patient to excuse you briefly. So I am going out of the room. Okay, so yeah, D is a bit better than E. In E, where I'm asking the patient to leave out of the room. So this I will not do at all.
What's your final answer? You need to rank it.
Okay, so my final answer is B, A, D, C, E.
Okay, thank you so much. Very good answer. So let's go through this question a bit by bit because this is a very typical question in the real exam. Very typical. You are F2. You in the exam, you have to understand you are always F2. Okay? So you are F2, that's fine, working in a busy outpatient clinic. So if you could highlight something or take some hints, you should start by this. This is the way you work out the questions. You have to recognize the concepts. You have to. After recognizing the concept, there would be like two or three. Then you have to decide which one is the major. Why? Because just fulfilling the major concept will tell you, is this answer upper tier or lower tier? Why I'm bothered? Because the question is ranking. The maximum score is 20. The minimum is 8 if you are not leaving the question blank. So it's between 8 to 20. So 20, 18, 16, they are high scores. 14 and 12, they are 50-50. 8 and 10, they are very low score. So your aim is always to score 20. The minimum you should score to score high in one question, 16. 16 is a high score, to be honest. So how would I do that? You have to understand every single stem is challenging you against a major concept. If you just spot that concept, now you can differentiate the answers into upper and lower. Upper tier answers, for example, let's say the ideal answer should be DC. If you flip them, CD, you are just losing 2 marks. You're scoring 18. That's fine. Why would you do that? Because you narrowed down your area of making mistakes by keeping them into upper and lower. So the upper tier answer, they will be altogether upper, D and C. So if you put them correctly, you are scoring 20. If you flip them, you are losing just 2 marks. But if you flipped, for example, D and presumably A was the last one, you are losing 4 marks here, 4 marks here, you are losing 8 marks just from the start. However, I believe it's very easy to recognize the concepts and it's easy mind job to know which answer is addressing the major concept. Generally speaking, if you are addressing that major concept, you are upper. If you are not, you are missing that major concept, you are lower. Now, even though if you didn't work hard enough, you will score 16 minimum. Okay, so how would I recognize the concepts and the skills? They are different by collecting the hints up. So first hint, busy outpatient clinic. That's very good. So it's busy. You are currently consulting with a patient who is visibly, yes, who's visibly upset and teary. Okay, this is the second hint. If you didn't watch the previous videos, please go and watch them. We have spoken thoroughly about this hint. If they are telling you patient is upset, patient is worried, patient is scared, something like that, this is a free mark for you. Believe me. The answer would be, write this down. The answer would be to address that upset patient. Again, SJT is like a matrix. If you know the hints, you score high. Whenever they are telling you there is a patient or patient relative or colleague is upset, distressed, angry, the first step would be to address them. This is a hint for you. However, this hint, like anything else in SJT, has a limit, has exceptions. What is the exception? Unless there is immediate patient safety. So, unless you have an immediate patient safety issue, you must address that upset, distressed, angry, crying colleague or patient relative or patient. What does that mean? Sometimes they might be super tricky by bringing someone who you should not care of into the picture. For example, patient neighbor. Would you be bothered by patient neighbor distressed or upset? No. So you should be taking care of the patient or the patient relative who are involved in the care, coming to the hospital, asking about their relative, something like that. So you have like professional boundary between you and them. You are the doctor, they are the patient relative. You are the doctor, they are your colleague. You are the doctor, they are nurses, something like that. But sometimes, very rarely, they become very tricky and asking you as someone who you should not care of. So you have to be very careful, okay? Now, this is your patient and distressed and upset or teary. Should you take care of him? Definitely yes. And this is a free hint for you. The answer should start by you addressing this uh, teary patient, unless there is immediate patient safety. So the question, do we have immediate patient safety here in this STEM? The answer is potentially yes. Why? Very senior member staff, very concerned, urgently. Okay, is the assumption applying here? Yes, definitely. That's why the thing we have been learning all the time. Now we came to the point, this is the exception. This is the point we need to prioritize something over upset and teary patient. And believe me, in the real exam, they always play with these exceptions. So you know, whenever there is someone upset and distressed, you have to address, you have to, unless there is immediate patient safety, this is immediate patient safety now. So the concepts, number one, distressed upset patient. Number two, immediate, potential immediate patient safety. Why? A very senior staff member, very concerned. So this is potentially immediate patient safety. Is it, and we have learned, what is the difference between concern and fact? Is it a fact the patient is distressed? Yes. Is it a fact patient is urgent and urgent care? I wouldn't say fact, but it's very strong concern. So you have to address that concern. So we have potential patient safety and we have distressed patient. We have two things. There is another hint, very subtle here. They might bring a question in the exam when the patient coming to see you, and that patient came after the clinic. You are heading off for your clinic. I'm not talking about ward or hospital, I'm talking about clinic. Would you see them? The answer is not necessarily. Why? What's the difference? Here, this patient came on time, and you are seeing the patient within their protected, designated time. This is their time. It's just like a contract between you and them. You are seeing them at clinic. This is their time. You should never ever prioritize anything over this patient because this is their protected time to speak to you, to tell you it's a history, confidential space. So you should not prioritize. Is there an exception? Yes, immediate patient safety. So again, this question is very deep and complicated. Whenever you are seeing patient within their own time, within their designated time, protected time, you have to prioritize them unless you have immediate patient safety. Why? Because immediate patient safety is first and foremost. However, how would they play around this? Believe me, what I'm telling you, we are answering three, four questions from just one question. In the real exam, they will tell you, okay, you are seeing one patient who came late, or one patient, she was not a patient. She came after your clinic and she is distressed. Would you see her? Not necessarily. Why? She does not have that protected time. So I'm very helpful. I want to see her. Again, you have to remember, you have your own well-being, you have your own like minimum mandatory rest. So you have to rest between shifts to work efficiently next day. If you are compromising that, you are basically putting your next day patient safety at risk, unless it is an emergency. Someone is presenting with very slow heart rate, very low blood pressure, something like that. We are all clinicians, we understand. But just for counseling, just for gathering information, you should not see them. Why? They don't have that designated time. They are not a patient in a sense. You don't have that professional boundary between yourself and them. Okay? This is very important. So, why I'm saying that? Because one of the trick in the real exam is to learn when not to intervene. That's really tricky. So, let's go back into the track. We have immediate patient safety. We have distressed patient coming within their protected, designated time. So you have to prioritize them unless you have urgent clinical task. Do you have? Yes. So, what is the major concern here? Immediate patient safety. Any option addressing that would be upper, any option missing that would be lower. Make it easy. Now we are having the luxury of the time in the real exam. You have 1 minute, 55 seconds for each question. You have to be very quick. And this is very easy, like mind job. Just recognize the concepts and say this is upper and this is lower. You can do that easily. A, take a message from the nurse. So the nurse is knocking the door and telling to you the nurse in charge wants you. So this staff nurse, the junior one, take the message from her, ask her, okay, what's the issue? What's the patient details? Something like that. So take the message. Is it going to address the immediate patient safety? A, definitely yes. I'll keep it upper. B, ask the nurse to put the call through. Is it going to address the immediate patient safety? Definitely yes. C, tell the nurse that you are currently busy. Is that going to address the patient safety? Definitely not. You are dismissing this. Definitely lower. D, ask the patient to excuse you briefly. Which patient? The patient in front of you who's distressed and teary. And step out of the room. Is that going to address patient safety? Immediate patient safety? Yes. So A, B, D, Alpha, Bravo, Delta, they are upper. Echo, tell the patient to leave so you can attend the nursing chart. Is that going to address patient safety? Immediate patient safety? The answer is definitely yes. So A, B, D, and Echo, they are addressing the immediate patient safety. Okay. Is there any subtle skill you need to learn in this question? The answer is yes. If you knew that, you will score 20. If you missed that, you will score 16, 18 minimum, which are very high score. So A, B, D, and E. So C should be the lowest because you are dismissing the immediate patient safety. You are not a safe doctor. So A, B, D are upper, and C is number 5. That's done. What is the skill that I want us to learn from this question? Why I'm bringing this question? This is very, very exam similar question. Why? Because the skill that you need to write down one of the take-home message while you are going through the options and reading one of the option, you could easily exclude that option without knowing the stem, without knowing the story. Why? Because this option is incorrectly built in itself. It's definitely going to be lower. What do I mean by that? Read the actual phrasing of A. Take the message from the nurse. Where are you now? You are at the clinic. What are you doing? Speaking with the patient who's distressed and teary. What are you doing in A? You are taking the message. What does that mean? You are taking patient details, patient history in front of other patients. What do you want to tell us? I want to say A is very major breach of patient confidentiality because you are discussing taking a message of other patient in front of other patient. Is that something professional? Definitely not. So, what is the skill that I'm talking about? I would call it like running exclusion. While you are running through when you are doing examination, there is running commentary. This, while doing abdominal examination, for example, this running exclusion. While you are running through the options, you exclude the incorrectly built answer. Why? A is definitely going to be lower, no matter what the scenario was. Why? Because A is against confidentiality. This can never be true. I can never accept something like that. But for me to tell C is upper or lower, I need to know the concept. I need to know the story about the stem so I can say yes or no. However, I don't need to know anything to say A is unacceptable. Why? Because A is definitely against patient confidentiality. So don't forget this. What I'm trying to say, believe me, in the real exam, they are using this skill a lot, discussing different topics, different concepts in the STEM, but when you come through the options, they are touching totally different concepts and values. They are not even mentioned in the STEM, so you have to be very mindful. What I'm trying to say, to answer one question correctly in the new trend of the question in the exam, you have to know so many things. You have to know immediate patient safety. You have to know how to address upset patient. You have to know about confidentiality as well. So they don't stuff the stem with so many concepts, but they spread them through the answers. That's very tricky. Again, A is against confidentiality. I will keep it lower. So let me ask myself, which is worse? Whenever you are comparing between 5 and 4, don't ask yourself which is better. That's difficult. Make life easy and ask yourself which is worse, to breach your confidentiality or to risk patient safety. What do you think, the doctor who did the question? What do you think?
Yes, doctor. I'll
Which is
prefer
worse?
the versus patient safety. I
Very
mean,
good. Very good.
confidentiality is
Very
okay.
good. Very good. Confidentiality is very major concept in SJT and in NHS. You can never breach that. However, if you have just two options to breach the confidentiality of one patient or to risk the life of other patient, definitely as a clinician, we are going to sacrifice the confidentiality, unfortunately. So A would be number four and C would be number three. Why? Applying this running exclusion skill. A is definitely going to be lower without me knowing the stem. And C, with knowing the stem, is definitely against the major concept. So both are very bad. So B, ask the nurse to put the call through. I'm not breaching confidentiality. Why? Because I will speak through the phone. The patient has no access to the phone conversation. So that's fine. D, ask the patient to excuse you briefly. Very good. E, tell the patient to leave. So how can I go through B, D, and E? Remember, we have two concepts in this question. Actually, three. One is very subtle. Two, let's say, obvious concepts. Immediate patient safety, and the other one was how to address upset patient, like patient dignity, patient upsetness. Which one of B, Bravo, Delta, and Echo is addressing that the most? What I'm trying to say, once you are done with the major concept, you have recognized which is upper, which is lower. Just doing that, now you are scoring 16 minimum, which is high score. So I want to score 20. What should I do? Apply the second filter, the minor concept, which is how would you address upset patient? That's something important, and it's almost always the most important concept, unless there is immediate patient safety, which is the case here. So which one of B, D, and E is addressing the patient upsetness or patient dignity? Which one do you think, doctor? Is it B, Bravo, Delta, or Echo? What do you think?
Ask the patient to excuse yourself is a better option. D.
Very good, very good. So in D, the patient is upset and teary. You are really taking care of him. He does not need to be teary and upset for you to excuse to respect his dignity and his presence. But this is just an extra hint. So that's very important. Why? Why? Someone might argue, for the sake of immediate patient safety, I don't need to take an permission. This is an immediate patient safety. Yes, but don't forget, this is his designated time. This is his protected time. It's just like a contract between you and him to address his issues within this time. So you are doing less. It's not his problem. You have to understand that. So that's why you excuse yourself. That's very important. On the other hand, they will bring you a question. You will remember that and will thank me later. Patient came late, or patient outside this designated time, or patient is not really your patient. Don't be tempted to treat him like your patient. You have to understand your limit, understand your own well-being, and the mandatory rest and these things. These are one of the points that have been challenged in the exam. They need to hire or to appoint a safe F2, a safe future CT1. That's why. So D is applicable here. Very good. A is number four and C is number five. Now we are scoring 18 minimum. And remember this, it's almost always very difficult to differentiate between number three and number four. So why? Because the major concept is not very solid with or against. So it's really vague area. You have to use your judgment. That's why the exam is not ethical, situational, judgmental. So which is number three? Which is number four? Is it B or E? Bravo or Echo? Bravo, ask the nurse to put the call through. And Echo, tell the patient to leave so you can attend the nurse in charge. Which one will you choose, doctor? Bravo or Echo?
Uh, uh, ec- uh, Bravo, because a patient is crying and it would be unempathetic to just tell
Very
him to
good.
leave the room.
Very good. Now your answer has been changed drastically.
Yeah.
Let's say remarkably. Why? Because you knew the concept. You knew how to work the questions out. Now we have the luxury of the time. In the exam, you don't have that. You have to be very quick on that. So you have to practice the rest of your days this way. What is the major concept? What's the minor? Recognize them quickly and challenge the options upper and lower. Don't forget if one of the options is incorrectly built, is harming a major concept by itself, you keep it lower without you thinking. That will save a lot of your time. Okay? So the final answer would be, would you like to tell us?
Yeah. So the final answer would be B, then
Bravo.
um, uh, D,
Delta, yes, then.
and then uh,
Then
A
Bravo.
will be the third. Yeah.
Yes.
Yes.
So Delta, someone should write in chat box, please. Delta, Bravo, Echo, Alpha, Charlie.
Okay.
Thank you so much. Thank you so much. Okay.
Doctor, I have one query regarding the option A. Take a message from nurse because the patient is crying, and it would be okay for me to step out of the room, or should I take the message? As you said, it's breaking confidentiality. Take a message from nurse. So then that's why we are ranking it lower, right? That's what I
That's
understood.
why, that's why the exam is difficult but fair. That's why they kept two options to challenge your understanding. Look at A and B. They're almost the same thing. One, preserving confidentiality. One is losing that. So that's why they brought two options. They are pretty much similar, but look at the difference. In B, you are asking for the code to be diverted to yourself, so you are preserving this confidentiality. In B, you are losing that. That's why.
Mm. Okay. Okay. Thank you so much.
No worries. Okay, who's going to take question two? Yes, Dr. Tariq.
So the final answer is DBAEC.
D, B, E, Echo, Alpha, then Charlie.
Okay, so you will tell the patient to go out.
Yeah?
Third one.
Why? Because this is going to harm his dignity, I wouldn't say dignity, his feeling, but A is going to harm someone confidentiality. We can't compare them.
And I can't tell the nurse that I am busy and someone can deal with
Why do you think that's not appropriate?
well, it's not the best option, but I think C, like telling the patient to leave when it's her appointment, shouldn't be like in the third,
Why?
because I can't tell the patient to leave.
Why you can't tell the patient to leave?
Uh,
What I'm trying to say, you have a concept in SJT, you have to either fulfill them or dismiss them. It's not about our common sense because they are telling you for a reason. Now you are F2, junior doctor, they want to know. If you are under that pressure, you have a potential immediate patient safety, something a very senior staff member telling you, I'm very concerned. Would you focus on patient who is teary and distressed, or would you focus on that emergency? That patient might be dying. So how would you justify in front of the court prioritizing someone who's teary and upset and one patient is dying? Would you be able to? No, never. So it's not about the common sense, it's about the major concept. That's why we are working this way. You have to know the concepts and you have to fulfill them. They might look against our common sense, which is fair. That's why this exam is very difficult.
okay.
Sorry,
Any
Dr.
more
Hussein.
questions around this?
Sorry,
More?
someone's trying to enter the session. Can nobody else enter the session, or because it tells them it's maximum capacity?
Oh, I have no control over the admin issue, to be honest, and I have no experience with that. I'm not, re-
Okay, all right,
I'm not
that's
really
fine.
sure, to be honest.
That's fine, thank you.
I'm sorry. Okay, Dr. Tal, will you like to take the OC? Yes. So, what concepts and skills have we acquired from this question? Now we have learned whenever we are having upset patient, upset colleague, upset patient relative, you must address between brackets unless there is immediate patient safety. So you must address unless there is immediate patient safety. That's very clear. Okay. So the STEM concepts are easier to pick, but the concepts within the options, they are really tricky. So this question is about that. And believe me, you will have minimum of 5 questions in the exam like this. The question is talk about something, and one of the options is harming a different value. So you have to be very careful. And you have to apply this running exclusion skill. If you got to know only one thing to answer this question, it would be that you must know in the real exam you will have up to 8 questions. 8 questions. This is almost 1/6 of the exam. 8 questions. You will have two concurrent issues, they are running side by side. Let's go back. Here I have immediate patient safety potentially, plus patient is very upset. So I'm under pressure. I have to address two major issues. Clinical issue, which is potentially very urgent, and like, let's say, social or dignity issue or empathy issue for the patient in front of me. So what my approach should be? Write this down because you will have minimum of 8 questions like this in different versions. So clinical plus non-clinical issue. Your aim should be you have to address both of them. This is your aim. That's why D is the best. D, you are taking care of your patient by excusing yourself, asking for permission, which is very nice, very professional, and addressing the immediate patient safety. So the ideal answer would be making these questions very easy and analyzed for you. Whenever you're having questions, when you have more than one task, most likely two tasks running side by side, you should start by addressing both issues. You should address both issues. Okay? If you can't do that, address the clinical. If you can't do that, anything else would be incorrect. That's why this is directly answering the last doctor question. Why we ask him to go out while he's theory? It's better to go for C. This is definitely going to answer. It's just like I'm expecting such a question. So that's why look at the red box. Two issues concurrently. The first step to address both. If you can't, address the clinical. If you can't, nothing is correct. Believe me. Everything else is wrong answer. You are going to score very low. Don't forget this. Please write this down. You will have at least 7 to 8 questions like this in the exam. When you have clinical plus non-clinical, try to address both. If you couldn't, address the clinical, but never fail. Never prioritize the non-clinical. You will score very low in this question. Okay.
Doctor, sorry,
Is
one
the-
question about this question, last one. Option B, which is ask the nurse to put the call through. So when I'm on the call, I'm not upsetting the patient in the room as well as I'm addressing the nurse in charge issue as well. So will that not be the first one?
Definitely not. Because when you have a patient in front of you, let alone a patient, if you have even your colleagues or friends, if you are going to do something, you have to excuse yourself. This is very professional behavior. You have to say, sorry, I'm doing something. You can't ask for the call to be through while you are doing that within his designated, protected, contractual time, let's say. Because this
Mm.
10 minutes or 20 minutes, this is his own time. You can't do that without asking permission. That's why it is the subtle skill here. You don't need to know that to score 18, but you need to know that to score 20. Because in every single question, there is a subtle skill you have to learn. The subtle skill is here, this is his time. So that's why. So he should have the control.
Okay. Thank you,
Again,
doctor.
Can I
address
ask
both. If you
one
couldn't,
thing?
address the
Sorry,
clinical. If you couldn't,
sorry to interrupt.
just give me
Regarding
1 minute.
take the
Just give
message.
me
Oh, okay.
give me. So both clinical, then nothing else. So is there an exception for that? Yes, you have to know that. If you have a clinical task which is very, very super urgent, and the non-clinical task is very trivial, you don't aim to address both. This is the only exception. Be very careful. What does that mean? Because this exam is situational, judgmental. So it's according to the situation. Give us example, I'm telling you. You are attending patient who is arresting, who is having cardiac arrest now. This is the top emergency in the medical field, isn't it? And one of your colleagues is very unsure, skeptical how to participate. Would you try to address both? The answer is definitely not. Why? We usually try to address both, but now they gave you a very extreme emergency and very extreme non-clinical job. He's just not sure how to help. This is not an issue in itself. Okay, you are not sure, that's fine. So when they are making it very extreme to very extreme, they are giving you a message. It is the case of exception for the general rule that you have learned. Now focus on the clinical alone. So you have to be very careful. Okay. Generally speaking, rule of thumb, address both. If you couldn't, address the clinical, but never fail. When they are giving you an extreme, how would you say that? We are all clinicians. You will know. Oh, this patient is arresting. This example is really extreme. So now you need to apply that exemption. Yes. One question before we move to question 2, please. Yes.
Regarding taking the message, can it be the message written message? Because we have concluded it's a verbal message, but what if it's a written message and the nurse can handle it to me and
Yeah.
the attended patient cannot?
Yeah, there will be this will be like taking a phone call. That's fine. But here it's not applicable because if you read the second line during the consultation, nurse knocks on the door. So they are making it. That's why A is different from B. They are challenging you fairly. A is different verbally. B is through the phone. That's why. Otherwise, they will be just similar.
Okay.
Let's Dr. Tariq, do question two, please.
Okay. So, Dr. Osa, I'm really sorry to do that, but before moving forward, since that you mentioned regarding identifying the concepts, I believe in one of your previous videos you mentioned before that even if you are stuck with identifying what is the main concepts, at least try to know if it is empathy or not empathy, right? Because the empathy are the only type of situation that we deal it differently. If there is any possible way that you would be able to clarify that for us, if your time allowed.
I wouldn't recommend that, to be honest. Why? Because identifying the concept itself is very easy, straightforward, very easy. If you studied SJT for 2 weeks, you will be able to do that. The difficult is how to apply skills, the thing that we are discussing now, and to know the subtle concept. But the major concept is more than easy to know them.
Perfect. Thank you so much.
No worries. Yes, do this question, please. We're really late.
Okay, so your consultant has asked you at the last minute to replace your colleague in presenting at an educational meeting at your trust, sponsored by a pharmaceutical company. You discovered that the presentation includes several chest X-ray from patients under your team's care. As you review the slides, you realize there is no documentation or mention of the explicit patient consent for the use of their images.
If you have done that question before, you might leave the chance for someone else to do it, and you can do the last question. What do you think?
No problem, of course, Doctor.
Okay, who will take this question? Someone else, please. We don't need to waste time, please. Raise hand. Anyone? I can't believe no volunteers.
I can take it. No problem.
Yeah, go ahead.
Shall I read through the choices?
Just the options. Yeah. So tell us, after reading the STEM, what do you think about the concepts?
So I think the main concept here is the patient consent for
Patient
presenting his
consent. Very
case.
good. Very good. What else?
Maybe because the consultant have requested that.
We don't know. So the concept is patient consent. Let's say confidentiality of information as well, isn't it? So consent is related to confidentiality here. And one of the concept is contributing into educational meeting. That's a goal for junior doctors, isn't it? We must do that. But the major concept is consent slash confidentiality. Okay, so how would you go through the options? What do you think? A, B, C, D, E. It's 3 best of 8, so you got to choose 3.
Okay. So shall I read them
Yes,
in my
please.
mind
Yeah.
or loudly?
Loudly, if you don't mind.
Yeah, okay. Proceed with the presentation as planned, given that no identifiable data is there. Anonymize the chest X-ray by removing any reports or clinical signs, then proceed with the presentation. Quickly ask the consultant whether it's ethical to use those films. Contact the patient to obtain consent for using the images. Refuse to use the X-rays and inform the consultant that you cannot present without explicit patient consent. Review the trust policy on using patient image for educational purpose if it permits. Do so before presenting. Omit the chest X-ray from the presentation and describe the finding based on your memory of images. Ask if anything happened to your colleague made him unable to present.
It's a very difficult question. And by the way, this is a question that I made up, but it's very similar to the exam style. So many issues going on. It's very difficult. You don't need to answer correctly at all, but tell us, what do you think about A? Is this something you might consider or not? B,
Yeah,
would you consider
I might consider A and B.
A and B? Okay. What about the rest? C, D, E, F, G, H. So what is your proposed answer? Just pick any 3 and tell us.
I can do A, B, and F.
A, B, and F. Okay. Proceed, anonymize, and review. Very good. No problem. Thank you so much for this answer. Thank you so much.
Okay.
So let's analyze the question word by word. Your consultant has asked you again, whenever you are seeing this, your consultant, that means consultant represents the GMC good medical practice, consultant represent the best practice, represent the patient safety. Whenever consultant saying something, you have to assume this is the right, this is the patient safety, this is the correct thing. Only consultant, please write this down. Is that without exceptions? No. So the skill is consultant represent the GMC good medical practice until proven otherwise. If you have a proof by GMC guideline, proof by guidelines, proof by another consultant who is more specialized, like microbiologist, hematologist, radiologist, something like that. Unless you have that evidence, you have to follow the consultant. Okay? So consultant ask you to, at last minute, this is another highlight. Why last minute? They definitely meant something by this. Whenever you have so many details, you have to be very careful. So last minute to replace your colleague. So the consultant, that means most likely this is the right step to do. Number two, it was just a light last minute to replace my colleague. So there is an issue. Why did that happen? And that's implying something. What is it? That means I don't know much about the process. I don't know much about the data. I don't know much about the presentation. It was just last minute notice. I need to work hard, yeah, but I don't know as such because it's just a last minute notice. I'm presenting at educational meeting. So the presentation is at educational meeting, that's fine. At your trust, at your hospital, but sponsored by pharmaceutical company. Why? We'll know later on. So you discover that the presentation includes several chest X-rays. Does that make any sense? Yes, because you are not being involved. You don't know about the data. Several chest X-rays from patients under your team's care. So the patients is your own patients. So you have access to the data. That's nothing wrong with that. But the problem is this presentation contains those chest X-rays. As you review the slides, you realize that there was no documentation. So this is another hint. No one documented or mentioned any consent from the patient. We are using their chest X-ray without explicit consent. So is it a fact or concern? It is a fact. There is no, because we have learned the difference between fact and concern. There is a fact, there is no documented consent. But is it a fact that no one took the consent? Maybe they took it, but they don't document it in their slides. So I don't know. Is it a concern? Yes. How should we treat the concern? If you have a concern, you can never ever dismiss that concern. You can never ever take the concern as a fact and take action on that. The only thing you could do is to explore more to know, is it a valid concern, invalid concern, or it's a fact? How would you know? By exploring, by gathering more data. However, if you have a concern, so if you have just two options, either to dismiss the concern or to take the concern as a fact, be more protective and take it as a fact. This is applicable in ranking question. However, 3 best of 8, you'll have 3 options. You don't need to do that. Again, concern, you can never ever dismiss or take as a fact without exploring more, without finding out. You have to find out. So you have strong concern about the chest X-ray consent form. So you have to find out. A, proceed with the presentation as planned. Can you proceed? Because he's a consultant. We say I have to follow the consultant until proven otherwise. Is it proven? No. Do I have a concern? Yes. So what should I do? Can I proceed? Given that no identifiable data. So that's very important bit. When you are reading the options, you have to read the full sentence. So proceed with the presentation as planned. Given that, so you are proceeding if only if no identifiable data. Is that enough? So we have chest X-ray, no identifiable data, not date, sorry, data is there, and but we still the issue of the consent is still there. Is A safe or not? We'll see later. B, anonymize the chest X-ray. So that's very good. Why not anonymize? So you should always anonymize the patient data. How can you do that? They are telling you by removing any reports, chest X-ray reports, or removing any clinical signs from the chest X-ray. How would you do that? I don't know. Then proceed with the presentation. So let's stop here. So I have chest X-ray. Do I need a consent for that? Someone should tell me. What do you think?
For educational purpose.
For educational
Very
purpose,
good.
we don't need a
Very good.
consent, but
Very good answer.
I'm
So,
concerned about the pharmaceutical sponsor.
very good. Very good 2 points. Very good. Thank you so much. So, either you know it or you don't know it. After this session, you know it. You don't need a consent for non-patient identifying blood tests like what? EEG, ECG, chest X-ray. These things you don't need consent for them because they are not identifying any patients. No one would know the patient from seeing ECG. No one would know the patient from X-ray. So you don't need a consent. Given that the personal data are anonymized, you cannot keep the name or the age or the hospital number or NHS number. You can't do that. So without them, the X-ray, the ECG in itself, you don't need a consent, given that you are utilizing them for educational purposes. Why? We have to know the theory behind that. Because it is like an implicit consent that the patient will agree that we are using their chest X-ray ECGs to discuss for educational purposes, because we do that in ward rounds, we do that in clinics. This is something implicit. You could assume that's acceptable, totally acceptable. If the patient argue, that's something different. But rule of thumb, you can assume there is an implicit consent to use these things. So you cannot use, for example, this concept to apply on skin mole. No, this is part of his body. This is identifying information. You can't do that. But again, EEG, ECG, sodium value, something like that, that's fine. However, you should utilize them for educational purposes. Why? Because this is something implicit. This is for the patient's sake. When we are doing these audits and presentations, the long-term effect is to improve the care. So that's fine. We need to do them. So you don't need specific consent. You need specific consent for pictures of the body, for something identifying. But this one, you don't need to, given that you are using for educational purposes. But there is a very tricky bit here. Sponsored by pharmaceutical company. Is that something educational or something commercial? Because if the purpose was commercial, I'm not allowed to. And by the way, they meant to be my own patient. So my access to the data in the first place was legal. So they are on my own patient, that's fine. You cannot grab files from orthopedic, for example, if you are working in medicine, that's not acceptable. You don't take care of these patients. They are not your active patient. So they are your patients, educational purposes, anonymized scans. Why not? Again, it is sponsored by a pharmaceutical company. Is that something would change the nature from educational to commercial? The answer is definitely not, because it is a fact. Look at the first line, an educational meeting. This is a fact. I'm trying to tell us, whenever you have a fact, don't overthink it. It is a fact, take as a fact. How would I know? If they state the information as part of the step, this is a fact. Take it blindly. So it is educational meeting, sponsored by whoever, that does not make any change because it is educational meeting. If they told you a meeting sponsored by a pharmaceutical company, now you have to use your judgment. But now you don't need to. It is a fact. Educational meeting, that's it. So the concept is you got to utilize them without taking consent. Why? They are anonymized. Educational meeting, and they are your own patient, so it's fine. So A is acceptable. B is very misleading. Anonymize the chest X-rays, that's fine, but read the actual phrasing, please. Don't lose easy marks. By removing, that's fine. Any personal data, I will accept it. Any identifying data, I will accept it. But removing what? Reports. Chest X-ray reports. Why would you remove the reports? The whole point around the X-ray is the reports, is the science. Not just like that. Remove the reports and remove the science. Is acceptable. So you have an X-ray and one of the signs is pneumothorax. How would you remove that? So you are basically because we need to conduct a very professional, high quality teaching presentations to improve the care. Now you are going against that. So one of the concepts here, teaching academic activities, teaching quality of care, something like that. So B is definitely against that. B is very bad. Why? Because I've mentioned three directions to treat with your own concern. One of them, to take it as a fact and just take actions. B is representing that. So B is definitely going to be wrong. If you know the concept, you will dismiss B. If you don't know the concept, but you know the skill of how would you treat your own concern, you will dismiss B. Why? Because B is taking your concern as a fact. It is not a fact yet. You don't know if the consent has been taken but not documented in the slide. It might be documented somewhere else in the notes, somewhere. You don't know. So unilaterally taking your concern as a fact and address them, that's definitely going to be lower tier. So this is very important skill. So B is wrong by two direction. C, quickly ask the consultant. That's very good because you have concern. Whether it is ethical. That is very confrontational and you are not asking to learn. You are asking, is it ethical to use this film? Like you are making judgment. If there was no problem, they are definitely ethical. If there is a problem, it's definitely unethical. So why would you make your judgment and say it might not be ethical? That's not acceptable. If you have a concern, you should say, I have a concern around the consent. So C is very, very wrong in terms of communication. It's very assumptive. You are making assumptions, and the communication is very bad. Is it ethical? This is not the way you speak to your consultant. So C is very wrong in terms of if you know the concept, C is invalid. It is ethical. It is valid to do them without asking anyone. However, if you are in doubt, ask in a very good way. You have to apply the communication. Again, the learning skill of exclusion, you can exclude C. Definitely without knowing the stem. Why? It's very rude, very confrontational. If you have a concern, ask to learn, especially when you're talking to your consultant. That's not the way. So C is definitely wrong. D, contact the patient to obtain consent. This is definitely wrong. You are making your concern as a fact. And don't forget, it was a last minute. You don't have that time to do. E, refuse to use the chest x-rays. This is very wrong. Why? Because you take it as a fact again. F, review the trust policy on using the patient image for educational purposes. Do you need to do that? No, not necessarily. If the time permits, that's very good. So if you have a time, you review for your own knowledge, for your own reflection, that's fine. So you know by choosing F, it is not a must. This step is not a mandatory, but if I have a time, I will do it. If I don't have no time, I know the concept anyway. Very good. Do so before presenting. That's fine. If time permits, that's very good. So this is like conditional. G, omit the chest X-ray. You can't do that. This is again taking your concern as a fact, which is very wrong. H, ask if anything happened to your colleague. Oh my goodness, what a nice option. You are taking care of yourself, of the patients, and of your colleague. Why? Because last minute he couldn't present. Maybe he's called in sick. Maybe something happened. So that's very appropriate. So I'm trying to say the only way for you to score 12 out of 12 in 3 best of 8, the only way is to know why every other option is wrong. This is the only way. Again, it's very tricky question. So you scored 8 out of 12, which is very good score. Thank you so much for that. But this question is really tricky. So what about this question? You have to know the concept of confidentiality. This is the major concept here. Number 2, you have to differentiate between patient identifying info and non-patient identifying info. Chest X-ray, ECG, this is a major concept. Again, one of the concern here, or one of the concept is the consent itself. There is something called implied consent or explicit consent. Implicit and explicit. Implicit consent, that's applying when you are taking a blood sample from a patient. If he did not verbalize, but he just gave you his hand, he does not need to write something or to verbalize, oh, I'm agreeing for blood test. If he just did that, that's fine. Implied consent. So we apply that for chest X-ray for these things, for educational purposes. We apply that for day-to-day activity like examination, like normal examination. And I'm saying that for a reason, like a blood test. So when do we need verbal? They need to verbalize that. If I'm doing intimate examination, so the implied or the implicit consent is not enough. You need to verbalize. I will do this, this, this. Do you agree? He should say yes or no. For body examination, normal blood test, chest X-ray, you don't need that. But for intimate examination, you need that. For blood test, that is testing STDs like HIV, hepatitis B, hepatitis C, you need that verbal. They need to verbalize. You cannot say we are doing blood test and include HIV. That's not acceptable. You have to understand that. So we have implicit consent, which includes day-to-day activity, explicit, which is verbal for HIV and HIV-like, and intimate examination, these two things. And utilizing their identifying information for educational purpose, like face or something like that. Omit the last one. You need a written consent for major operation, total knee replacement, total hip replacement. These things, endoscopy, you need a written. They need to write and sign. And for identifying information like their face, their body, their information, this is meant to be like written. Okay? So we have now learned between the implicit, explicit, and written consent. They might ask you, do you need a written consent for HIV? No, just explicit. They need to verbalize that. That's enough. Again, what is the only one thing, if you knew, you will answer this question correctly, to read the actual phrasing. The actual phrasing of the stem. Here, look at B, anonymize, remove, that's very good. You'll be misleaded. But can you remove clinical signs and reports? No. So what's the point? Again, read the actual phrasing of the stem, the actual phrasing of the answer. It's very tricky. Any question around this? Okay, so last question. Who's taking question 3, please?
Sorry, Dr. Qasay.
Yeah.
Those who could not attend today, would they have access to the recording?
I believe so, yes. So UKRC, I've asked them, they said yes.
Okay. Would it be on the website or
I think it'll be in their YouTube channel. We will
okay.
publish that, don't worry.
Thank you.
No worries. Okay, so who's doing question 3? Yes, Dr. Muhammad?
Yes, doctor.
Yeah, go ahead.
You are a F2 doctor in obstetric working in an antenatal care. You are waiting to talk to a midwife about your current patient. The midwife is assertively informing another patient of the risks of smoking during pregnancy. The patient does not appear to be listening to the advice. The midwife turns to you and says, "This woman will not stop smoking. What have you got to say to her, doctor?"
Okay.
Okay. Firstly, A, explain that you are sorry, but have actually come to talk about another patient. B, ignore the comment from the midwife and instead and ask the midwife about your patient. Agree with the midwife explaining to the patient how demanding smoking in pregnancy. Say to the patient that it is the best not to smoke, but it can be very hard for someone to stop. Say to the patient it is difficult to comment as you do not know the full fact of the case.
This is one of the most difficult question I've ever seen. And you will find 2, 3 questions like this in the exam. So what's the point from bringing this? If you could remember, the first question was totally about working under pressure. The second question was professional integrity. This question about empathy and sensitivity. So they are the 3 major concepts you will be challenged against in the exam: professional integrity, empathy and sensitivity, and working under pressure. So that's why I brought a question from each domain, and every single question contains so many things, concepts, skills, subtle skills, and working the question, and if it's differential, will help you to understand maybe 3, 4 questions in the exam. So let's work this question out. Now, in this question, what concepts do you think we are talking about, Dr. Muhammad?
We are talking about empathy because
Very good.
nurse is talking in a not good way with the patient,
Very good.
and also some patient safety because the
Very
patient
good. What do you mean by patient safety here?
she is pregnant and she smoke.
Very good. Very good. It's not just sympathy. We have a patient who needs care. She's pregnant, and we know smoking might lead to miscarriage, might lead to so many complications.
Yeah.
So that's very important. Not just her baby as well. So what do you think about A, B, C, D, and E? Tell us.
I think explain that you are sorry, but have actually come to talk. It is not addressing the patient safety and also not dealing with the nurse act, like you are not helping the nurse.
The midwife, yeah.
Yeah. So it is middle, but
No.
it is the middle.
Mm.
Ignore the comment from the midwife and instead and ask to the midwife about your patient. So this will be lower than A. C, agree with the midwife explaining to the patient how damaging smoking is in pregnancy. This will be below it will be B, then A, then C. Say to the patient that it is the best to not smoke, but it can be very hard to for someone to stop. This is the best. This is the best. Say to the patient, it is difficult to comment as you do not know the full fact of the case. Also, this is somehow good. So I'll be D, E. The worst one is B. D, E, A, C, B.
Okay, thank you so much. Good answer. And this question is very difficult, and you don't really know what the concepts are. So we have a patient smoking and she is pregnant. That's a patient care, patient safety. She and her baby. And we have like patient-doctor relationship, inter-colleague relationship, your relationship with your midwife, how would you correct her? So she's in front of the patient, she's underperforming, she's speaking in an unacceptable language to the patient. We should never criticize patient by saying they will never stop smoking. This is not acceptable, they're unprofessional. Can you advise or correct her now? The answer is no, because she's in front of the patient. You cannot correct the mistake by doing another mistake. That's the thing you know, you should know. But if the insult was very severe, you got to stop her. Again, if your colleague is insulting patient, making derogatory comment, racial comment, you should stop him because we don't tolerate that. But if they are being rude or something, you might ask him to step out and speak to him, not in front of the patient. Okay? Your aim is to support him, to make him better doctor, not to confront him. Unless he or she exceeding that limit, they are now becoming racist, derogatory comments. This is intolerable. You have to challenge and stop them. This is the first subtle skill we have to know. Again, being rude, you don't need to confront. You need to correct them, maybe aside from the patient. If it came to a point they are insulting, they are racist, you got to challenge them, no matter whatsoever. But if the insult has already gone, you speak to them later. Talking about something going on now, okay? So we have a duty toward the midwife, duty toward the patient who's smoking. And don't forget, we have a duty toward my own patient on the clinic, obstetric gynecology clinic. I am taking care of my patient and came to ask. So I have three, like let's say, dual patient care here. The smoking lady and my own patient, don't forget. So A, explain that you are sorry. Explain to whom? To the midwife. So how that is useful? How can I utilize this? What is this achieving? Explain, that means you are not ignoring the midwife, you are addressing her. This is the inter-colleague relationship. So you can address your colleague by verbally answering him or practically doing the thing, or number three, explaining why not. Both are addressing, three of them are addressing. That's very appropriate addressing. So now you're addressing your colleague and you are telling her, I'm here to see my patient. So you are addressing the midwife, you are not ignoring her, intercolleague relationship. You are addressing your own patient. What are you missing in A? You are missing the smoking lady, which is the most important concept here, the smoking lady. Why? Your own patient, we don't know about her. They made it vague. It's important, but it might be something just paperwork, discharge, we don't know. But this patient really needs help. She's smoking, and this smoking needs counseling. So now the most important thing is this patient, then your own patient, then the intercolleague relationship between you and the midwife. And it is important to preserve the patient dignity because the midwife has been a little bit rude toward the patient. So you cannot tolerate that, but you cannot advise her now. It will be something later on. So A, missing the major objective, which is the smoking lady, but addressing the others. B, we have learned again, this is a new skill we have learned, how to address people verbally, practically, or explain why not. B, ignore. Okay, I'm telling you, to ignore is the worst thing to do in terms of communication. You can never ignore. So ignore the nurse. That means this is the worst thing toward inter-colleague relationship. But this is not the most important concept. The most important concept is to support the smoking pregnant lady and to see your own patient. So ignore the comment. That's not the best to toward your colleague. And instead, ask the midwife about your patient. So at least you are addressing your own patient. So A is similar to B. In A, the difference between A and B, in A, you did not ignore the midwife. You are explaining why not, which is very good. And plus, you are focusing on your own patient. In B, you are ignoring the nurse, which is very harmful in terms of inter-colleague relationship, your relationship between you and the midwife. But you are addressing your own patient. So A and B, they are pretty much similar, but A is superior because you are addressing more points. You are addressing the minor objective and the objective number two, which is your own patient. In C, agree with the midwife. That means you are addressing the midwife. You are really relieving her, but you are insulting your patient by accepting this rudeness, explaining to the patient how damaging. So you are in C, addressing the patient in sense of giving her information how damaging the smoking in pregnancy. However, you are agreeing with something that is very rude toward the patient. It's really carrying mixed message. So good to the midwife, very bad to patient because you are agreeing about this very bad communication toward the patient. And at the same time, you are giving advice. That's why this question is really difficult. D. Say to the patient that it is best not to smoke. So you are addressing the midwife by giving advice. She's asking you for advice. And you are addressing the patient by giving her an advice. But it can be very hard. So you are excusing. Is it something you could do? Yes. Why? Because really, smoking, this is a fact. Smoking is addictive. It's like a receptor in your brain. So something very hard for some patients. So you are not like making silly excuses or being unprofessional. That's something very accurate medically. So why this is important? Because now you are relieving the patient because you are telling her, I know the midwife is being rude, saying you will never stop, but having difficulty is something acceptable. As a clinician, we know that. So you are relieving that bit. So I agree with Dr. Muhammad. D is the best. You are ticking all boxes. E, say to the patient. So you are addressing the midwife. How come? Because she's asking you to say something. So you are addressing that. Speak to the patient. It is difficult to comment. Okay, so you are coming back to square zero. You are telling the patient, I have nothing to say. Difficult to comment. As I don't know the full fact of the case. It's really difficult. So at least spot the very wrong answer. D is the best one. I agree. What is the very wrong answer? Definitely C. Why? C, you are agreeing for this rudeness, despite you are giving advices. But don't forget the skill, the running exclusion skill. C in itself, despite you are giving explanation, is very rude. Can we accept rudeness? No. Why? Because we have learned if the patient is upset or distressed, you have to address them first to relieve them, then they can accept anything from you. So if you turn this the other side, you cannot make the patient upset. She will never accept anything. So if you are accepting this rudeness and telling her, yes, I agree, the patient will never accept your advice. So C is being very rude. This is very low. What about B? The difference between B and E, A, you are explaining to the nurse, I'm sorry, to the midwife, and I'm here for my patient. What about B? B is the same. No. One of the concepts, this is why you must know the concept in the STEM. One of the concept is patient care and patient safety. When you ignore, you are ignoring the midwife and you are ignoring the patient care, which is a smoking pregnant lady. So B actually, so superficially, B is ignoring the midwife, but deeply, B is ignoring giving advice to someone who needs it. So B is against patient safety. That's why B is the worst answer, believe it or not. Why? because B is very unsafe. You know someone is needing advice, needing counseling, smoking during pregnancy, and you deliberately ignored. So you might tell me, we have learned before, I should never ever assume. In A, if I'm not assuming anything, I explain I'm not here for this, and I'm not speaking to the pregnant lady. So A and B, both, they are not addressing the pregnant lady. Why B is number 5 and A is not number 5? What do you mean by that? Okay, this is the new skill. What is it? When they are phrasing ignore, that means you are showing the examiner, I am cautiously going to ignore the concept. I'm not missing it because I forgot, slipped off my mind. No, I know the concept and I'm ignoring it. That's what it means. That's why in A, they did not mention anything about this, the smoking lady, and it was not against patient safety. But B, it was against patient safety. Why? Because you are ignoring. So in A, you are addressing one patient. In B, you're addressing your one patient, but you are deliberately, cautiously ignoring this patient. You are telling the examiner, I will just going to ignore her. That's why B is very unsafe. So Bravo is against patient safety, which is number 5. Charlie is against patient dignity, you being rude. You are seconding, accepting rudeness to patient, which is very unacceptable. But being unsafe is worse than being unprofessional. Again, patient safety is first and foremost. To harm patient safety is the worst thing. So B is number 5 and C is number 4 and D is number 1. Now you are scoring 18 minimum. It's very difficult. If the question is very difficult, so many information, stick to the basic. D is clearly the best. Which is the worst? C, being rude. Bravo, being unsafe. You are deliberately ignoring one patient. When you have no urgent matter, why would you ignore a patient? If you have a resting patient, I can understand that. But why would you ignore someone who needs help, who needs a management? Counseling is part of management. So B is against patient safety. Bravo. Charlie is against patient dignity. Delta is the best answer. So between A and E, again, it's very difficult. Number 2, 3, 3, 4. Which is better? To say it's difficult to comment, you don't know the case, and that's it, and do nothing else, or to explain, I'm sorry, and I'm here to see my patients. Now, which option is ticking more boxes? E, echo, is almost not being rude, yes, but you are not addressing the midwife, you are not addressing the patient, you are being neutral. A, you're addressing the midwife by explaining, I'm sorry, this is addressing, and you are addressing your own patient. So A taking more boxes. That's why A is number 2. So the answer would be Delta, Alpha, Echo, Charlie, then Bravo. It's very difficult, but it's very good exercise for us to know. Luckily, in the exam, you will have 1, 2, maximum 3 questions like this. And I hope they are pilot questions. So when you have something like that, just at least try to grasp why the answer might be very low. Keeping C and D, B and C at the bottom, you are scoring 16 minimum. A at the top, you are scoring 18. Fair enough. That's why.
Can I ask a question?
Okay, just 1 minute.
Okay.
So, in this concept, you have to know patient care versus anything else. Patient care will just outweigh. Definitely. That's why if you are ignoring the midwife, this is a bad in terms of communication. If you are ignoring the midwife who's asking advice for the patient, that means you are ignoring the patient. That's why it's very unsafe. Very tricky. So, communication. To ignore is the worst. In terms of communication, if the question was about communication, there was no patient safety, to ignore would be the worst. Okay? So, now in this question, we have dual patient safety, my own patient and the midwife patient safety. So, it's really tricky. What is the one thing you would know, and you will answer this question, is to recognize the concepts. If you recognize there was a patient safety and ignore is against patient safety, I ignore the patient safety, you will keep it number 5. You keep being rude number 4. And you keep this number 3, you will score 16, 18 minimum. That's why the key skill here is to recognize the concepts. That's why I'm repeating myself. Please recognize the concepts. Very important. Yes, what was your question? Sorry.
You have just mentioned that if you have 2 things, one is unprofessional and the other unsafe. you would prefer to be unprofessional
Definitely.
than being unsafe.
Yes.
So if I'm confused between both, I'd go with the unprofessional.
Yeah. Why? Because we have agreed patient safety is the first and foremost. You can't excuse yourself. You can have that excuse in front of the court if something went wrong. I been trying to save the patient because of this. But if you did otherwise, you have no excuse. Any questions?
Okay.
No.
Yes, doctor, I have a question.
Yes.
So why haven't we put E as a last option? Because it does not address the concern that we have regarding our own patients.
In Bravo, you are telling the examiner, I have a patient safety, patient care, someone is smoking, who needs help, who needs counseling, discussion, and I'm deliberately ignoring this. So deliberately ignoring patient safety is very unsafe. In A, basically in A, the outcome is the same. You are not addressing this patient, but you are not ignoring. That's the difference. In A, you are not telling the examiner, I will ignore her. You are not saying that. You say, I focus on different things. This is practically the same thing, but it's a concept. So in B, you are telling, I might have the option to ignore the patient. No, you don't have option like that. But in A, it's just slipped off your head and you focus on something else. That's why you're scoring less. But in B, look, they are very pretty much similar. But A is number 2, believe it or not, and B is number 5. Why? Because of the phrasing. That's why you have to read the actual phrasing. In B, you are ignoring deliberately. In A, you are missing. So you are focusing on something else. That's fine. But to tell the examiner I'm deliberately ignoring, that's unsafe.
Yes, doctor, understood. But I was asking about E, that why have we put it as an upper option when it is not addressing the concern regarding our own patient that we actually care?
You should tell me. The way that I've started the answer, it was really confusing, difficult. I agreed with ourselves that B is definitely against patient safety, ignoring. And C is definitely against patient dignity, being very rude. And if you are being very rude, the patient, you have to know they will not accept anything from you. If you are saying, you patient, you are very fat, but do you think, have you considered doing exercise? She will never accept. So, see, basically, you are doing nothing. You are giving no advice. Oh, you might say, I'm giving advice, but you're giving advice after accepting rudeness, which is definitely going to lead to nothing. That's why. So, E is not being rude, it's being neutral, it's doing nothing. So, being neutral. So, let me give you an example. Now, you are with the patient and someone being racist to patient and you are not being there, you have been in different clinic or something, would the patient feel angry toward you? No. But if you have been there and someone is being racist to the patient and you're saying, oh yeah, you should accept it, how would the patient feel against you? You are like a partner of this crime. So in C, you are partner of this crime. This is very unacceptable. The only thing that is worse than being very rude to patient is to be unsafe. That's the only exception. Just to train ourselves that patient safety is the worst thing we could harm. Anything else is less than that. It's very unacceptable to be rude to patient or to accept rudeness. However, patient safety is even the worst to reach. E is doing nothing, basically being neutral, but you are not being rude and you are not being unsafe.
Okay, thank you. Understood.
No worries. It's a very difficult question. Any more questions or should we move? Okay. If we don't have questions, what should we do? If in the exam, I'm talking about SJT, you will have two types of questions: ranking and 3 best of 8. For ranking, never assume. After reading the stem or the option and full stop, tell your brain and do nothing else. Is that going to be nice option or not? This is for ranking. For 3 best of 8, never ever duplicate your job. I see this happening a lot. For example, escalate to education supervisor and escalate to clinical supervisor. You can't do both. You have to choose one. For example, your colleague is doing less, speak to him privately, send him an email. You can't do both because the outcome is the same. If you are going to do something, do it once. So you have to pick 3 options, they're adding new value. Again, you can't do the same action twice. Escalate to supervisor twice, your education and clinical. Escalate your, that makes no sense. So one of the major traps in 3 best of 8, because it's easy to lose marks. Every single option, if you got it correct, you will score. It's four marks per response. So you got to choose three. So the total mark is three. So you could easily score 8 or even 4, missing 2. So don't duplicate the job. This is one of the very common mistakes. Okay. Just for the sake of the time, what should we do now? I have 1 day, 2 day, 3 days till my exam. What should I do? I'm talking about SJT. Please do one mock now, mock exam. There are some mocks available online, and there are some mocks are very popular. So do the mock. Why? After doing the mock, giving that you know the correct answers. I don't know how that's reliable. You will know your weaknesses. You'll know in this question, this question, this question, I have really like a pattern of losing marks in 3 best of 8. And I always lose marks when they are, for example, challenging 3 concepts in the same question. Privacy, confidentiality, and autonomy, for example. So I need to focus on that. So you have to know your weaknesses. This is the way you will score higher. You have to know your weaknesses and to work them out. This is the only way you could improve, you boost your score. So personally, I do one mock, and I believe it's very, very similar to the real exam. And even the feedback from the people who did the mock was very, very good. So if you could do that mock, that would be very, very useful for the rest of your timing. So you could do the mock, and after that mock, you will have like a feedback of every single question. What are the hints and what are the concepts in every single question? Then you will have like an explanation for these questions. You don't really usually tend to have a explanation for the mocks, but they are very well explained in audio. So you will get to listen to every single question explanation, and you will have like a personalized feedback about this. So if you are willing to do that mock, I would really recommend this. If you are not willing to do that, do any mock now to know your weaknesses. You have to know, because theoretically knowing this, the concepts is not like practically doing it. So let me share with you the link of that mock if you want to do it. And by the way, these are like free resources. If you want to watch more videos from the lectures that we have done, you can scan. This is the website I'm talking about, and this is the free Telegram channel. Before taking your questions, let me just. So I would be happy to take questions now till we send you the link. Any questions, please? Yes, go ahead, Dr. Saliha.
Yes, I wanted to know about safeguarding. So we know that for children, we have to safeguard them whenever there is a history of abuse or anything related to their safety, right? For adult, we can't involve safeguard if they're capacitable, and if they deny, that we can't involve. But then for vulnerable adult, which age defines vulnerable adult, and can we involve safeguarding team if they deny?
Very
Even
well.
if they have capacity.
So these are practically two different questions. If you want to involve safeguarding, you have to check the capacity. If the capacity is telling you this patient is capacitable, you got to follow their wish. Is there an exception? Yes. If there is like life-threatening injury, someone is trying to kill them, you cannot allow murder. Someone, for example, has been gunshot. Can you listen to his consent by telling you not to tell anyone? The answer is no. This is an exception. So, unless you have that severe injury, you don't interfere. But what if you want to involve safeguarding for patient? If they are dementic, you can't do that. Unless they are telling you they have a capacity. That's a different thing. If they didn't tell you that, you can involve the safeguarding for the sake of dementia. But someone is being abused, no matter the age was. I'm talking about adults, not kids. You got to assess the capacity and to follow their wish.
Even if they're very fragile, very elderly, like
They
a
have
specific
capacity or not?
emergency. Yes, they have capacity.
You got to, unless it is life-threatening injury.
Okay.
Now you got to. Why? Because you are stopping murder. Now you can do that.
Okay. Thank you.
No worries. Does anyone knows how to access the chat? Don't know.
I want to ask a question regarding
Yes, go ahead, please.
regarding doubling actions. When you mentioned clinical supervisor and educational supervisor, actually they are two different personnel.
Of course,
So
they're two different personnel, but the action is the same. So you are doing the same action in two different personnel, which is duplicating your job. What is the aim for you to approach them? I'm talking about escalation. You want to escalate. Why would you escalate twice? What is the new outcome you would achieve? So you cannot do the same thing for the same person twice, and you call it duplication. This is the same thing. So I'm talking about doing the same thing for different organization for different destination. That's the duplication. So you don't need to.
So if I have like a problem in workload and there was options to inform the consultant, the manager and the rota coordinator, I can't choose all three. I have to choose one of them.
That's a very good question. So let's say I'm struggling with my workload. Whom
Yeah.
should I tell? You should tell the education supervisor. Why? Because of my own well-being. He is the one who's taking care about my pastoral health, which is very good. You have to do that. If And I should tell my consultant because of the clinical touch of the problem. So I'm telling them for different reason. I'm not here escalating. I'm telling my education supervisor for my own well-being, which is he is designed for that. And I'm telling my consultant for the clinical bit. Why? Because I know the education supervisor is consultant in different department. He might not be even in the same hospital. So that's why. So now in this specific instance, you are doing two different things. You are taking care of two different things. You are not duplicating your job. That's fine. That's very appropriate.
Hi,
Okay.
thank you so much for the session. I had a quick question, if that's okay.
Yeah, of course.
I was doing a question and it was basically I was in surgical F2 and there's an unconscious patient in A&E and I've been asked by my SHO to go examine the patient's abdominal aortic aneurysm. So basically I was just trying to figure out what are the rules around consent with an unconscious patient, but for your own educational and training purposes.
I remember that question very well. Uh, you can see and do clinical activities as far as it is clinically safe. Can you be a supervisor uh, and ask people to like examine? No, this is outside of your remit. Why? Because you are not an educational supervisor. You are just an F2. Can you see the patient? Yes, because in that exact example, the patient was safe in resus and has been seen already. And the SHO is asking you to come and just to examine him for your own sake. If they are telling you the patient was on his way to theater, you can never stop them because this is immediate patient safety. If they are telling you the patient start to deteriorate, you can never examine him because this is not your job, you understand? But if they are telling you he was safe and it is safe for you to examine, yes, go ahead, but you cannot be the supervisor yourself and ask that person to come and examine. This is not your job. Who told you for that medical student the best for his level is to examine triple A? This is not your job.
Thank you. So basically the consent is sort of implied here because it's for my
Oh,
training
you're talking about
purposes.
the consent because it was an abdominal examination, it's
Yeah,
implied.
yeah,
If it
yeah.
was like rectal examination, you need explicit consent. If it was like a breast examination, you need explicit consent. So that's why it's very important to address one question in all aspects. One of the things that we have spoken about, the types of consent. That's very good example. Thank you for bringing this up. So because it was abdominal examination, you don't need a consent. It's implied. But if it was rectal, no, you need a consent.
Doctor, I have a question regarding the mock. If my exam in 3 days,
Hmm.
I will get the feedback after how
I
long?
would recommend you to do it as soon as possible. Why? Because after you are doing the exam, you will get your result. Then you will get your result across, because this mock has been done by a lot of your colleagues. So you will get your mark across the cohort. So we will give you the raw score, and we will give you the scale score. Because in the SJT, in the real exam, you will be scoring 250, 260. This is not your raw score. This is your score against the cohort, against the average. How are you doing against the average? So we are doing the same. So you'll know what is your score against the average. So if you are scoring 250, that means you are just on the average. If you are scoring 290, that means you are one standard deviation above the average. That's very high. So something like that. Not just like this, you will see the hints under the subtle hints after each question, and you'll have access to the audio to have the explanation of the mocks. And I believe it's very similar to the exam, so it'll be very
Okay,
useful to you.
my exam in 3 days. I will
So
receive the
do it
feedback.
today or tomorrow.
Okay,
This process is automatic. Whenever you do it, you will get you will be emailed your score, and you'll get the feedback, and you'll get access to the audios immediately.
okay. Second question, doctor, regarding medical student. Are they able to help us in clinical settings? Like
They have a
medical.
remit. They can do history, they can do examination, they can't do unsupervised procedure because they are not signed off yet. They can do cannulas under your supervision, catheter under your supervision, that's fine. But they can't do something autonomously. They can take history and examination, yes.
Okay. Last question. If there is a patient not speak English, but your colleague speak his language, it is okay for your colleague
That's
to
very tricky. If they are telling you similar language, that's not enough because we have so many similar language in this world. So thus anything might compromise and very accurate history taking. This is against patient safety. Using translator, using hand gesture, using similar language, that's very unsafe. But if they nominate the language French, Urdu,
Yeah.
Arabic, that's fine.
And
Okay.
if
So
it's a
this will
relative,
be this will be rank above the translator of
Very good
of
question. This is very situational. If it is very time sensitive, yes. If it is not time sensitive, you are at GP, you are at outpatient clinic, it's better to wait for interpreter.
Okay. Thank you.
No worries.
Dr. Qusay, I have a question.
Yes.
If my consultant is doing something that is not professional, such as being in a relationship with a patient, can I speak with the consultant, or do I have to tell someone else to speak with the consultant?
Very good, very good. If you have an underperforming senior colleague, that's very rare in the exam. So, to what extent? If you are talking about probity, taking money from patient, like fabricating data, you ought to confront them. That's very rare. Why? Because of again, to correct an underperforming colleague, you must assume they are good. If they knew the concept, they will follow. And this is applicable for junior doctors. That's why if you have someone breaching confidentiality, you have to explain to them. It's very important. But if it's senior and something that the STEM is telling you, your consultant is doing that deliberately. It's not lack of understanding. You will have some hints like that. And please go back to the videos that we have done before. You will see one example like this. Your registrar was telling you, I had a speed fine, and please lie with me, comply with my lie to the police so they take this off. So you don't need to. One of the options was to explain to her that's inappropriate. You don't need to explain. She's telling you I'm lying and I need you to lie to get over that fine. So you don't need to explain. Here, it's facts, they understand, and they are lying for a purpose. So the answer is to confront. Tell them that's not appropriate. Please tell the police, something like that. So if they are doing something wrong, is there a hint they are understanding or there was no hint? If there was no hint, you got to explain. If there is a hint, they understand and they're doing that deliberately, you got to confront them.
Also, I have just a quick question.
Yes.
So the question about the DNA testing. So what is the concept about it? Because I didn't understand. Like
Say it
the
again.
one the DNA test. If someone like asking, to check the DNA test for a patient, like assuming he's his spouse or his relative. Can we do that, or we have to discuss with, or we can't?
If you have the question, you can drop in the chat box while we are taking the other questions, and I will be happy to take it.
Okay, thank you.
So I'll go by order: Dr. Kashim,
Doctor,
then Muhi, then Musila. Yeah. Yes, Dr. Kashim, do you have a question, Dr. Kashim? If you don't have question, Dr. Muhi. If you don't have Dr. Wasila, then Ala, then Saliha, then Maria. Yeah.
Yes, Dr. Osai, Assalamu alaikum.
So,
I have a question regarding if I was need to do like to take a photo of a skin lesion and to send it for clinical purposes, and I didn't have official camera or things on the world or in the world. Do I need to? What can I do? Do I need to use my
very
phone?
good.
Because
Skin lesions
yeah,
are never urgent. Very extremely rarely. So if it is an urgent patient safety, you got to speak to your senior, you got to involve someone else before breaching confidentiality or using like unprofessional equipment. What you should do, there is an professional photographer for these things. You got to ask him. If there was not option or you are exhausted that, you got to escalate. If you have just two options, to ignore it or to go unprofessionally, look back to the scenario. Is there something urgent or not? Is it urgent? Yes, you go to breach confidentiality. If it is not urgent, you go to wait.
sorry, I can't hear you
I
properly.
have another question. Sorry, just quick questions about if I missed in GB setting and I misdiagnosis and the patient came back, for example, abdominal pain, I sent home and she came back as ectopic. I found it on the notes. Do I need to apologize? Do I need
Yes, of course.
to mention this issue or just
Yes,
go on?
definitely. Whenever you are doing clinical mistake, it's duty of conduct. You must.
Okay, thank you.
Yes, Dr. Ala, then Saliha, then Maria, then Shaima, and then we will conclude. Yeah.
Hello, doctor. Thank you
Hi.
for the session. I have a question regarding when you've been asked to do a procedure by someone, maybe a senior. I don't know the rationale. Sometimes they be like, you have to do it. It's a learning opportunity.
Very
And
good question.
sometimes
Very
they
good.
be like,
Very good question.
no, you have to
I will
delegate
give you a
it.
general rule.
Okay.
We have like three classification of procedures. Procedure that you will never ever be able to do or to consent for, like total knee replacement, total hip replacement. Why? Because you are in that department for 4 months. Don't forget you are just F2. You are not capable to do that procedure. So you don't understand the complication. So you cannot do the consent and you cannot do the procedure at all. And there are procedures that you must do. Why? Because by definition, you are F2. By definition, you know them, like uh, intraurethral catheterization, venipuncture, VBG. These things, you must know them, like taking history. So these things, you are not an F1, let alone F2. If you don't know them, you are signed off to do them. So you must do them. And there are procedures in the middle, gray zone. You need proper training to do them, like lumbar puncture, chest tube, these things. You are not initially qualified, but you can have some observation training and you can do them easily. So the question would be regarding three classes. So let's say class A, the total knee replacement, you can never do them at all. This is unsafe. Class C, you can never refuse. They might tell you you are not comfortable doing cannula. You're not comfortable doing catheter. I'm talking about adult cannula and intraurethral catheterization. So if you are not comfortable, don't do them, but don't ask senior because this is like an F1 business. So you ask someone at your level. That would be acceptable. Or you do it and you tell the patient I'm not confident, and then escalate to your senior afterwards. So this is the fact. But if it's class B, let's say, you never do them if you are not trained because they are not safe. You are not safe to do them.
Okay, if the STEM stated that I'm not confident, I should
You should not do them, but
stipulate
you should
that
not
I'm
escalate
not
to senior.
confident, right?
Yeah.
I've seen a question earlier today. It was like a senior consultant asked me to do suture in the theater.
Okay.
So
So the best answer was to explain to him you are
yes.
not confident to do that. The worst answer was to do that, and there were three in the middle. One of the worst is to ask your colleague. Why? Because you are not a supervisor. You cannot
Mhm.
like delegate or signpost task for people outside your remit. You can share with them workload within your department, yes, but you cannot say for your colleague, you do the suture. You are not a consultant, so that's why. And you have two options, either to do it or
Get
sorry,
instructed.
either to ask him for instruction
Mhm.
or to ask him, do it, I will observe. Again,
Yes.
this is very situational. Ideally, you should ask him to do it so you observe. But since this is just a
That's what I
suturing
thought.
and he is a consultant and the patient is anesthetized, so the harm would be very less. So situationally, in this example, and he is there to do it under his instruction is better. That's why this example is not ethical, it's situational. So I really agree about this answer. So you have two options, either to say, do it, I will observe, or to ask him about instructions so you do it, because it's just suturing. It's not. It wasn't like taking the appendicitis out or something, appendix out or something. So it was just suturing, patient anesthetized. The harm would be very minimal. So that's why. That's why. So it's
Okay.
situation. The answer is situation.
Okay. Thank you.
Hope that makes sense. Yes, Dr. Saliha. Then Shaima. Then we'll conclude.
Sorry,
Yes, I
Dr.
have
Said,
a. Sorry,
I
yeah,
put
go
the
on.
I'm sorry, I put the question on the chat. The
Okay,
DNA.
I'll look into it. Don't worry. Yes, Dr. Saliha. Then.
Yeah. So, in the classical scenarios where a patient invites you to their house party, so we decline it first, we explain, and then we decline. And
Very
then
good.
sometimes the next best option is to ask our colleague to take care of the patient, right?
Thank you.
Now, if in the scenario there is another option where it says inform your consultant. So, which one will I choose between informing my consultant and
Very good. Very good.
asking the?
Okay.
Yeah.
The problem is we can't discuss everything here. Yes, it is really thorough. However,
Yeah.
easy role to apply. You should explain to the patient because you have to assume they did that for the sake of gratitude, being nice, but you have to explain to them. If you don't do that, you can't ask someone else to take care unless you believe the relationship between you and the patient has been broken. Someone is being racist to you, or someone is giving you a money. That's a very extreme thing. Now the relationship between you and him has been broken. You cannot be his doctor anymore. You have to arrange for him to be seen by someone else. Just invitation to house, that's not the case. This is not a very extreme. So this is something in the middle. But if you have a better option like seeking advice, again, you have to be very literal. If they are telling you inform your consultant, it's
Yes, that's
not
it.
just
Inform
like
your
when
consultant.
they are telling you seek advice from a consultant. They are different. You have to be very literal. Seek advice, that's something very, very advisable. But just inform your consultant, hmm, okay. So between them, just inform your consultant or to arrange
Ask the.
for someone else, I would inform my consultant. Why? Because I'm assuming that the relationship between me and the patient has been broken, and it's not the case. It's very extreme.
Okay. One more question, please.
Yeah.
Yeah, so about signing that certificate, right? Like from Oxford and the conventional law that we know is basically we should not sign and we can't sign a patient we haven't seen, right? So when I'm on call, let's say, and I have to sign it as certificate, but then if there is the note, a complete note is not sparse,
You can,
note is
yes,
there,
you can. So
even if I don't, even if
yes,
I don't know the patient.
yes. If we are talking about discharge summary, death certificate, anything that you have enough information, very official, like from the patient, from the team, from note, yes, you can do that.
Even if the signing, like the doctor who saw the patient is not here.
Yeah.
Like, because there is a case where the doctor, for example, Sarah, she wasn't here. So we asked the party to wait for till Monday.
Because the example was, it was like out of hour, and you just started the shift and you don't know the patient. I remember the question very well. So that's why.
Okay. Thank you very much.
No worries. Yes, Dr. Shaima, last question.
Yes, doctor. Thank you for this.
No
Very
worries.
informative. Thank you. My exam was in 1 week,
Okay.
and I'm asking about the mock. Actually, I have entered this exam last year, and my score was very low in SJT.
You will do better this time, inshallah.
Inshallah. So, how can I use this mock to increase my marks? And
I would really recommend that to do it as soon as
mm,
possible. Why? Because you got to know your weaknesses practically. You have to know where are you needing some boost. How would you know that? To challenge yourself against something pretty much similar to the exam. When you do that, you will say, okay. But the problem is after doing that, how would you know the subtle concept? You are missing
Yes.
this question because you don't know the subtle
Mhm.
concept. That's why this mock is providing. It's telling you the subtle concept is this, this, this. You need to focus on these things and giving you explanation for that, which most of the mocks don't do, to be honest. So that's why I recommend this. So you'll get the
It's
explanation
not.
and you'll get the hints after each question.
Hi, sorry, I
Yes.
put a question in the group chat
Thank
actually.
you.
I was just wondering if you could please clarify rules about, like sort of regarding prescribing diazepam and controlled drugs in a GP setting, because sometimes you might be concerned that the patient's abusing drugs, or do you need like a urinology, like a urine toxicology
We
test?
have, Doctor, we have like a long list of hands up, so let's go through them if you are doing more questions. So, have you finished, Doctor Shaima? Have you finished your question?
Not yet, actually, but you were clarifying for me how can I use this week.
Yeah, yeah. So,
I'm talking about 7 days. How can I use it after the mock to increase my marks
as I
in?
told you, it's automated process. You will register for it through the website. You will do the mock. You will get your feedback. You will be given the access to the explanation, and then you will have your feedback is you have more missing question according to around this subtle scale around this concept. So you will have that sheet. You will have that document.
Okay, and these tips can I
Oh yes.
apply
What's
to?
the next step after that? I would strongly recommend you to go to different resources, which I will nominate after we stop the video. So you can challenge yourself again after knowing that weaknesses.
Okay, doctor, thank you.
No worries. So I think we should stop at some point, to be honest. I would love to take all questions, but we're really running late. So let's take one question from the chat. I don't know how to address that chat. I think I'll stop the video here and we'll take the question from the chat. If you want to stay behind, that's fine. We'll take your questions, but let me stop the video.
Just answer Dr. Muhi question, Dr. Ghosai, sorry.
Because I'm really now struggling how to access the chat and how to. Just give me a minute. Okay. Oh, this is the chat. Okay. So where was the question? So you are F2 working in ITU. You are managing a patient with COVID-19 pneumonia who is currently unconscious and lacks capacity. The man named, what's that? Sorry. Sorry. The man named John comes to the department stating that the patient you are treating is his father, requesting a DNA test to be performed. Definitely you can't do that. Ask John if he knows the test requires the patient's consent. Very good. Refuse to arrange DNA test. Safe, but not the best of communication. Talk to the patient's documented next of kin. No. Discuss the request with the ward sister. Not very good option. So I will go with A. And I'll keep C number 4 between B and D, either to refuse straight away, which is very safe, or to discuss the request with the ward sister. So here's a very tricky point. If you are discussing, that's no harm for discussion. But if we are speaking about very fundamental concept, it's better to show the examiner as a F2, you understand the GMC economic practice very well, and you are competent about your concept, especially if you are talking about something very fundamental, autonomy, confidentiality, patient safety. It's better than to look hesitant and you don't know what to do. Again, discussion is not bad, but in this question, I'm 100% sure it is a confidentiality issue. I'm not allowed to breach confidentiality at all. So discussing with the ward sister, what is going to add? Is she going to say yes? I'm not taking her yes. She's saying going to say no. I need to show that I'm very confident. One of the subtle concept, I always focus on the subtle concept. Here, understanding your competency as F2. You have to be very competent at preserving confidentiality. That's why A is very good, explaining the concept. very like explanatory. B is very safe. C, safe but hesitant. And D is the last option. So I'll go A, B, C, D, E. A, B, C, D. Again, let me stop the record.